नमस्कार। आज हम लोग बात करेंगे प्रेगनेंसी के दौरान हेपेटाइटिस सी के इन्फेक्शन का। बेसिकली एंटीनेटल चेकअप होने के कारण आजकल प्रेगनेंसी के दौरान हेपेटाइटिस सी का डिटेक्ट होना काफ़ी कॉमन हो गया है। सो वी विल ट्राई टू अंडरस्टैंड कि अगर किसी का हेपेटाइटिस सी पॉजिटिव आता है ड्यूरिंग प्रेगनेंसी, व्हाट शुड वी डू। The best way is एक क्वेश्चन लें तो this is question number 2. The question is a 28-year-old primigravida at 18 weeks of gestation is found to have positive anti-HCV antibodies during routine antenatal screening. HCV RNA is detected with viral load of 1.2 into 10 to the power 6 IU per ml. Liver enzymes are normal. She is HIV negative and has no history of IV drug use. Ultrasound of the abdomen is normal. Now the question is, which of the following statement regarding management and vertical transmission risk is most correct? First, direct acting antiviral therapy should be started immediately during pregnancy to reduce vertical transmission. B. Elective cesarean section significantly reduces vertical transmission of HCV. C. Breastfeeding is contraindicated in HCV positive mothers. D. Vertical transmission risk increases with high maternal viral load and HIV co-infection. And E. Ribavirin monotherapy is safe during pregnancy for prevention of fetal inspection. So, dear friends, let us learn about hepatitis C and what's its importance in pregnancy. So, hepatitis C is an RNA virus which has got strong tendency to have a chronic infection of the liver. Most of the individual infected are asymptomatic and it is usually diagnosed by antibody, which is anti-HCV antibodies, which indicates exposure. It doesn't tell you about infection. If there was past infection also, this anti-HCV may be positive. So for confirmation of active infection, HCV RNA should be positive. So when there is HCV RNA positive, then only a mother can transmit the virus to the child. What is its epidemiology? Global prevalence is 1% and it's almost similar in India. And most of the women are diagnosed for the first time during pregnancy. Often there is no symptom related to liver, and when a patient is diagnosed with HCV, it brings about a lot of fear and confusion, and that's why counseling becomes more important than treatment during pregnancy. So what are the mode of transmission of hepatitis C? So well, before 2002, when universal screening was not done, blood transfusion was most common. Apart from that, unsafe injection, tattooing are common causes. Vertical transmission is known to occur, but vertical transmission occurs only in 5%, and that too only if mother is HCV RNA positive. So we need to educate people that HCV RNA does not transmit with food, water, touch, hugging or sharing utensils. It is not waterborne. Now, what are the impacts of HCV infection on mother? It is usually a mild disease. It usually does not affect maternal outcome. Most of the pregnant women either do not have any symptoms or only mild symptoms, and there is usually no worsening of liver disease during pregnancy. However, there is slightly increased risk of ICP, that is intrahepatic cholestasis of pregnancy and gestational diabetes. These risks are associations, not inevitable. That means it doesn't mean that if patient has hepatitis C infection, they will surely develop ICP. However, there is increased risk. Now, cirrhosis is rare in pregnancy, number one, and another part is that if patient has advanced liver disease, fertility is reduced, so probably they will not become pregnant. So what we would say, hepatitis C in pregnancy is usually a monitoring issue, not a maternal emergency, and it doesn't require treatment. What are the impacts on fetus? Maternal to child transmission, that is MTCT, risk is 5 to 96%, which means 95% of the fetus of HCV RNA positive women will not get infected. Transmission occurs only if HCV RNA is positive. Antibody alone does not transmit infection. The risk is increased in certain situations, especially when mother has high viral load or mother has HIV co-infection. Importantly, mode of delivery does not significantly alter transmission risk, which is why elective cesarean section is not recommended solely for HCV. The most important message is that nearly 85% of the babies are born uninfected. Even in babies who acquire infection, many will clear the virus spontaneously during early childhood. How to do antenatal management of hepatitis C? So once you diagnose hepatitis C during pregnancy, the goal is monitoring and prevention of complication, not antiviral treatment. LFT monitoring is essential because most women remain asymptomatic. Rising transaminase or cholestatic pattern may indicate intrahepatic cholestasis of pregnancy or disease flare. HCV viral load should be checked if available. It helps in risk stratification of mother to child transmission. However, viral load doesn't decide antenatal management of mother. Screening for HIV and hepatitis B has to be done because co-infection with HIV increases the risk of transmission. Hepatotoxic drug, alcohol should be avoided, and commonly used drugs and herbal medications should be avoided because they are known to worsen liver functions. A very common misconception is cesarean section reduces hepatitis C transmission. This is not true. Vaginal delivery is safe in women with hepatitis C. Risk of transmission from mother to child is 5 to 6%, and mode of delivery does not significantly influences this risk. So dear friends, LSCS is not routinely indicated for hepatitis C alone, and cesarean section should be done only for standard obstetric indication. The key principle during delivery is to minimize fetal exposure to maternal blood. Therefore, avoid invasive procedures such as fetal scalp electrodes, prolonged rupture of membranes, unnecessary instrumental deliveries. Few words about breastfeeding. Breastfeeding is a common concern in women having hepatitis C, but let me assure you, breastfeeding is safe in mother with hepatitis C. Hepatitis virus is not transmitted through breast milk. Multiple studies show no increase in mother to child transmission risk with breastfeeding. Therefore, routine avoidance of breastfeeding is not recommended. However, there are certain conditions in which breastfeeding should not be done. If nipple is cracked or there is bleeding from nipples. So under such situation, breastfeeding should be temporarily withheld from the affected site. Expressed milk can be discarded until healing occurs, and once nipples heal, breastfeeding can be safely resumed. What is the role of antiviral drugs? So directly acting antiviral DAA are not used during pregnancy. This is not because they are ineffective, but because there is insufficient safety data in pregnancy. They are therefore not recommended by current guidelines. Hence, no antiviral treatment is initiated antenatally even if viral load is high. The reassuring message is that treatment after delivery is highly effective. Modern directly acting antiviral regimen achieve more than 95% cure rates. Treatment duration is short, it is 2 to 3 months. Antiviral therapy is planned after childbirth and completion of breastfeeding. So treatment is pregnancy is a period of monitoring and reassurance, and postpartum is the time for cure. Few words about neonatal follow-up. Follow-up babies born to hepatitis C positive mother, but it should be done at the correct time with the correct test. Early testing options include HCV RNA testing at 2 to 6 months of age, detects active infection early, and negative RNA test is reassuring but may need confirmation. Definitive testing option is anti-HCV antibody after 18 months. Early antibody testing is unreliable due to the fact that antibodies may be transferred from mother. However, the most important reassuring message is that many infants clear HCV infection naturally. So even if you find HCV RNA positive, there are chances that a spontaneous remission or a spontaneous cure will occur. Hence, not all RNA positive infants become chronically infected. So don't test too early with antibodies. Do not panic if early RNA is positive, and ensure proper follow-up. What about partners? That has to be once again very much reassuring. Your wife can have normal life in the family. There is no risk of day-to-day transmission. So the stigma has to be countered. Now, partners should be tested. Sexual transmission of HCV is uncommon, but it is possible. Partner testing helps in early diagnosis and reducing anxiety, planning treatment of the partner if needed. Safe sex advice has to be done. Routine barrier contraception is not mandatory in monogamous couples. However, if there is concomitant HIV infection or sexually transmitted disease or multiple partners are there, then contraceptive safe sex should be used. No isolation is needed because hepatitis C is not spread by food, utensils, hugging or living together. The mother and the baby should not be isolated in home or hospital. So dear friend, this is not a socially transmissible disease and a normal family life can continue. So we go back to the question, and what do we see? The right answer is vertical transmission risk increases with high maternal viral load and high HIV co-infection. We have seen directly acting antiretroviral drugs are not routinely recommended in pregnancy due to limited safety data. Cesarean delivery is not recommended solely for HCV infection. Breastfeeding is allowed unless nipple are cracked, and ribavirin is teratogenic and is contraindicated. So once again, take home messages. Pregnancy outcome are usually good. No treatment is needed during pregnancy. Breastfeeding is safe and postpartum cure is possible. Thank you very much for your patient hearing. If you like this video, you may please share it and subscribe our channel. Thank you.